So this is Unit 1, Process of Human Diseases and Introduction for Practical Nursing, Georgian College. So Unit 1 is Homeostasis and Disease. The course is really about pathophysiology. The old name of this course, rather than Process of Human Disease, was Pathophysiology 1. And pathophysiology is the study of abnormal functioning of the body and how the body responds to changes. So it's really like physiology, except with the abnormal. So what can go wrong with physiology? This is pathophysiology is mama bear and papa bear, too hot, too cold, too soft, too hard. Physiology is baby bear. So when we talk about pathophysiology, we really need to kind of break down the etiology. Where does it come from? There's all kinds of different topics under etiology, and it's important for us to understand the etiology, where a disease comes from, in order to logically apply some preventative measures and maybe prevent the disease, or it's useful in treatment. You have to understand what's going wrong in order to make things go right. So in etiology here, there's A and B, idiopathic and iatrogenic. Idiopathic means we don't really fully understand the etiology yet, that the cause is unknown. Idio, as in idiot, means don't know. Iatrogenic means it comes from the process, it comes from the procedure, from the doctor. Iatrogenic diseases are caused by the doctor or by the procedure. A lot of things we actually do understand the etiology of, and so, like, for instance, we understand the etiology of scarlet fever is an autoimmune response to a streptococcal infection, etc. Related to the etiology is pathogenesis. What is the progress of the disease? Again, pathogenesis is really an important study, especially for nursing, because it helps us expect what's going to come next. It helps us know when things are progressing the way they should, as opposed to taking a turn for the worse or having complications or other things happen. Pathogenesis is the normal course of the disease. Clinical manifestations are the signs and symptoms. This is what we see, what's going on. So signs, if you look at the definitions PDF and watch that video, are things that we can measure. So blood pressure is a sign. Temperature is a sign. Vomiting is a sign. There's no question. When somebody vomits, they've vomited. Passing blood, bleeding, etc. Those are all signs. They're objectively observable. Symptoms are subjective. Symptoms are what the patient is feeling. Pain is a symptom. Nausea is a symptom. And the clinical manifestations are the collections of signs and symptoms from that particular disease entity. And then treatment implications are important as well, because that's ultimately what we are trying to do as healthcare professionals, is institute a evidence-based logical treatment. Now, for the purposes of this course, we are not going to spend very much time on treatment implications. It's just not a major part of this course. It's what you'll get it more in your clinical courses. So to understand physiology, to understand pathophysiology, you have to understand physiology, you have to understand anatomy. So you have to understand what it's supposed to be like in order to observe what's gone wrong, to change this normal structure of function. Yeah. And we study it mostly for prevention of disease, or for treatment of disease. A lot of diseases are very complex. They're not as what you think of when you first see it. They present challenges with diagnosis and treatment. There are some diseases that are notoriously difficult to diagnose because the signs and symptoms, the manifestations, vary from individual to individual. Things like multiple sclerosis, notoriously hard to diagnose because it's so complex and the manifestations are so variable. And so and there's various implications of those signs and symptoms. They could mean a lot of things. So there's a lot of things that can give you inflammation. There's a lot of different things that can give you flu-like symptoms. So when you look at some signs and symptoms, this is the challenge. When you're diagnosing something, you are really making a list of the possibilities. We call this the differential diagnosis. And then you do tests to eliminate things off that list. So for instance, if a patient comes to see me and they have sciatica, I kind of make a list of the different things that can cause sciatica. It could be a herniated disc. It could be a tumor in the spine. It could be bone cancer. It could be a compression fracture. It could be problems with the sacroiliac joint. It could be a problem of an acute problem with a facet joint. It could be spinal stenosis. It could be a neurological problem. It could be shingles, a herpes virus. Any one of these things can cause the symptom of sciatica, pain along the sciatic nerve. So I make a list of the things that it could be when the person tells me that. Then I take a history and I realize, oh, okay, they don't have a history of accidents and they're not, and blah, blah, blah. You find, and so you narrow this down. And then you start to do orthopedic tests to see, well, is it a disc herniation? And if Laseg's test is negative, no, it's probably not. And again, and you eliminate it down until you are left with what it is. But the point here is that the signs and symptoms have various implications, and it's our job as health professionals to try and sort that out. And once we sort that out, understanding the processes and the normal pathogenesis of the disease will have implications for prognosis and telling the person what to expect. So, oh, you've got a strained sacroiliac joint, 6 treatments, and I'll be doing this, and within a week and a half, you will be feeling better. That's the prognosis. Right? So diagnostic tests and treatments have become more and more sophisticated all the time. But it leads to different dilemmas, ethical dilemmas, legal dilemmas, all kinds of things. Um, for instance, we can now genetically manipulate pigs to produce human blood, human type O negative blood. Is it ethical to be harvesting that blood from those pigs and using it on humans? If that's ethical, well, how about we insert the genes that the pigs produce histologically human kidneys? Then can we harvest the kidneys to do kidney transplants, etc.? There's a whole subject on these ethical and dilemmas. So I've already mentioned that signs and symptoms, what they are. Symptoms subjective, signs objective. Syndromes is a collection of signs and symptoms that don't have a definitive cause. In the definitions, I talked a little bit about that. But a syndrome is when the signs and symptoms could be adequately explained by a number of different things. So, the clinical course, we have the incubation period, the latent period. It's the time between exposure to something and the first appearance of signs and symptoms. So, in the COVID pandemic, one of the problems with this SARS virus is that there is a long latent incubation period. It's up to 2 weeks. So people are asymptomatic carriers of the disease and don't know it yet. Prodromal signs are the first appearance of signs and symptoms, and they might be vague, and they might be not what continues. So for instance, people with migraine headaches often get prodromal visual symptoms. The visual symptoms don't necessarily last, but they are the first symptoms that the process of getting a migraine manifests as. Acute is usually an abrupt onset, short duration, full intensity. It might be the most severe. We can have a second latent period, a decrease of intensity of signs and symptoms, even a total disappearance, but the disease isn't necessarily gone, it's in remission. Subclinical is when the person might not even be aware. There might be no signs and symptoms. So really, diagnostic testing is the important thing. My son has a congenital kidney problem, a genetic problem with his kidneys. And for most of his life as a child, he was getting regular blood work, and we were monitoring the kidney function, and he had no signs and symptoms, but we could see the progression of the disease. We could follow it through his creatinine levels. In my extended family, Jeff's creatinine scores were like baseball scores. Everybody knew them. And it was quite some time before it started to manifest as signs and symptoms, as clinical manifestations. So then that brings us to some questions about health and how you define it factors that affect health. So, according to the World Health Organization, health is a complete physical, mental, and social well being and not the absence of disease or infirmity. So, when people say they are in relatively good health, relative is the definitive statement. No one is really in perfect health because mental and social well-being become a part of it. There's a bunch of factors: age, gender, genetic makeup, your location, even the time of day, all impact your health. So, yeah, this is a complicated thing. So, any profession that is trying to improve people's health has to look at all of these factors. Now, some of these factors, like age and gender and genetic background, really can't be altered. Time of day can't be altered. So we can mitigate the effect of these things as much as possible. Prevention is the idea of not letting things get to a disease state. So there's primary, secondary, and tertiary. So primary levels are to prevent it from even rearing its head, like not smoking, being careful about how much sugar intake, things like that. Secondary is to prevent things that there are real predisposing factors and that it's imminent. Tertiary is after you already have it and you are trying to get rid of it or make it not come back again. So disease, the World Health Organization, is defined as a deviation from the normal structure or function of any part, organ, or system, or any combination of these things, or from a state of wellness. So there's all kinds of diseases. It's all around homeostasis, becoming unstable, not being able to be maintained. Disease is subtly different than a disease. So a disease is something that is well defined. So you have Huntington's chorea. It's a disease. It's genetic. So, yeah, there's a whole discussion that we'll probably have in our WebEx meeting. So homeostasis, we've talked about. So homeostasis is maintaining stable internal environments. And compensating for external pressures, for stresses. Allostasis is the process that supports homeostasis for the change. So allostasis is the reaction to those external or internal changes that are affecting homeostasis, affecting staying within the normal parameters. So, for instance, a stressor might be exercise. You are at the gym and you're running on the treadmill. Well, that's going to be burning up a lot more oxygen. So that oxygen has to be delivered to the tissues, and delivery of that will mean that an increased cardiac output. So the vascular changes involved with delivering more oxygen to the tissues, the breathing changes involved with that, the taking the deeper breaths, etc., dilating capillaries in the lungs, or arterioles at least, that kind of thing. That's the allostasis. So that's the reaction to the changing need. So allostatic load is the wear and tear on the body from over or underactivation of these compensatory mechanisms. Allostatic overload is the cost of that, that when there's excessive and it's not adequately regulated. There is a school of thought that says allostatic overload is the cause of most disease. So, for instance, you are constantly requiring higher than normal cardiac output. It could be to overcome resistance, increased peripheral resistance, because you've put on a lot of weight and you've increased the number of blood vessels. The allostasis is to increase the contractility of the heart. The allostatic load is the ventricle actually getting bigger. An allostatic overload is when the ventricle becomes so enlarged that the lumen starts to decrease, and now it is turned into a disease. So there can be all kinds of allostatic overload on different organs and different systems. And so I'm not going to go through all of this. There is another video that I have posted where I actually do go through this same chart. It's worth a look. So oftentimes allostasis is involving multiple organ systems at the same time, so that cardiovascular disturbances will lead to respiratory disturbances, which might mean to immune problems, etc., endocrine problems, etc. So I'll have you just look over this. Now, the next few slides here are homeostasis and the stress response. Stress is an important enough topic and how it relates to disease that we're doing a whole unit on it. So at this point, I'm only going to superficially mention it. We call it the general adaptation syndrome. This is the allostasis that happens because of stressors. And stressors are any disturbance to the normal homeostasis that the body has. So it could be infections, fever, emotional responses, heat, cold, anything like that. So this was studied by a guy named Seeley, and he came up with this thing called the GAS, the General Adaptation Syndrome. So eustress is productive stress, and it prepares our body. Distress is bad, it's harmful, that lowers our resistance to infection, etc. And there's a very fine line between eustress and distress. So there are various stress responses where the stressors stimulate the hypothalamus to releasing hormones, and the releasing hormones cause the thyroid to release more thyroid hormone to increase the metabolic rate of tissues, the there are hormones that are going to affect the liver, increase the release of triglycerides and glycogenolysis to increase blood sugar. The ACTH will cause the release of the adrenal cortex to release the mineralocorticoids to increase to change sodium specifically, to increase water retention and raise blood pressure. The glucocorticoids, cortisol, promotes gluconeogenesis, catabolizing proteins to sensitize blood vessels, and it's anti-inflammatory. And all of these things happen more or less simultaneously. And at the same time, the hypothalamus causes the sympathetics to fire, which causes the adrenal medulla to release the catecholamines, epinephrine and norepinephrine, and the visceral effectors will again have a fight or flight response, and you get increased heart rate, etc., 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 everything on this list. So all of this happens more or less simultaneously, but these are all threats to homeostasis. Again, we'll talk about the alarm reaction, but this is the original, the first reaction, the fight or flight. Then we end up with resistance and the body releasing hormones and making kind of longer term things. Eventually this can lead to exhaustion because you use up the resources, and then you have to recover from the stress. Now again, there's a whole unit on this, so this is just a first look at it. In assessing, I've already kind of mentioned this, but when you assess a patient, you want a complete medical history. And it's really to assess how how it's manifesting with that patient. It's the signs, it's the symptoms, and you want this to be holistic, that because there are so many factors involved in disease. So the definitions is, there is a PDF of these, and these things are all defined on the PDF. So this is constantly changing. Our understanding of all of these pathophysiology processes are constantly developing. Research is giving us insights into the pathogenesis of all kinds of different diseases. This is what cancer research is about, and diabetes, and ALS research, AIDS research. All of this is trying to increase our knowledge, move things from idiopathic to understanding. And as we understand, and we have greater abilities to investigate because of technology, then treatment options improve and technologies for treatment improve. So this is an ongoing developing thing. So I want you to think about the difference between signs and symptoms, why pathophysiology is important, especially as your role as a nurse, and the parameters that an epidemiologist will consider when studying disease. We will talk about this in the Thursday meeting, and so we're going to look at, so Mr. Disorder, Overweight truck driver, 6 days a week on the road, smokes a package a day, eats at fast food, sleeps only for 5 hours. His father died of a heart attack. He's been admitted to the hospital with chest pain. He has indigestion, left arm's tingling. He has cardiac ischemia, according to his ECG. Does he have a myocardial infarction? So he's been diagnosed as angina. So what are the predisposing factors? What are the signs on admission? What were the symptoms? What complications can develop? What sequelae may develop? And what's the etiology of angina? So we will talk about this in our WebEx meeting. So I would ask you to at least think about it, and we'll, it's a good topic for us. So you can look at things from the World Health Organization, the CDC, health units, health departments, all have resources with information on all of this stuff.